Welcome to The Connector, where we connect North Carolina to ideas and North Carolinians to each other. This podcast series is from the Institute for Emerging Issues at North Carolina State University. And now to the conversation.
Welcome to The Connector. I'm your host, Sarah Hall, Director of the Institute for Emerging Issues at NC State University. Today, I want to take us back to last year's Forum on Financial Resilience and share an important update from one of our esteemed speakers. The 2024 Emerging Issues Forum examined the ability of households to financially withstand and recover from economic challenges. According to a 2023 survey by the Consumer Financial Protection Bureau, 40% of American households would be unable to cover more than 1 month of expenses if they lost their primary source of income. During our panel discussion on strengthening support systems, United Way of North Carolina President and CEO Brittany Pruitt Fletcher shared an exciting announcement about an upcoming report designed to give us a better picture of financial hardship, specifically in North Carolina. The ALICE report, which stands for Asset Limited, Income Constrained, and Employed, places a spotlight on households earning more than the federal poverty level, but less than what it would take to cover the cost of basics, such as housing, childcare, food, transportation, healthcare, and more. Brittany, we're so glad that you could join us today.
Glad to be here. Thank you for having me.
Yeah. So before we get into the ALICE report, I know United Way of North Carolina is doing some incredible work. I actually served on the United Way board from 2014 to 2020. In fact, I might have been rolling off as you were rolling on before you became the leader of the organization. So can you give us, our listeners, a brief overview of United Way of North Carolina and the work that you all do?
Sure. United Way of North Carolina is a state association. Been around for almost 50 years, partnering with 47 local United Ways to co-create solutions to people's most meaningful challenges. Our mission is to bridge people, local United Ways, and resources so individuals, families, and communities thrive in North Carolina. And we really take a comprehensive approach of listening and responding to statewide needs, and really thinking about how do we strengthen local resiliency, advance health, youth opportunity, and financial stability in our state. We do this through 4 core areas of work: our member services, so supporting our United Way network across the state with professional development and networking opportunities, our NC211 program, which is managed by United Way of North Carolina. This is multilingual and a confidential service that provides health and human service information and referrals through a free statewide phone number, 211, or through the website, nc211.org. And then we play a big role in disaster response, being part of the state emergency response team, managing the governor's North Carolina Disaster Relief Fund, and supporting our local United Ways there. And the 4th core area of work is really advocacy and working with public and private partners to co-create solutions that ensures that everyone has the resources, support, and opportunities and networks that they need to thrive.
Brittany, thank you so much for that overview. And it reminds me, we need to have you back as a guest to talk about 211 or some members that run that, because that in itself is actually an incredible tool and resource. So we'll have you back another time. But let's get back to the ALICE report. So say a little bit more about why United Way of North Carolina decided to invest in this report, and what was that process like for y'all?
Sure. We decided to invest in the ALICE report really to shed light on financial struggles faced by a significant portion of North Carolina households. So as you mentioned, ALICE stands for Asset Limited, Income Constrained, Employed, and represents households that earn above the federal poverty level, but they're still struggling to afford basic needs such as housing, childcare, food, transportation, and healthcare. And so the process of developing the ALICE report was comprehensive and collaborative. United Way of North Carolina partnered with United for ALICE, which is a U.S. research organization that drives innovation, research, and action to improve life for people in financial hardship. And the report was created using rigorous methodology, and it's updated annually with input from experts from state and national research advisory committees. And the team of researchers works closely with these committees to ensure accuracy of the data, and then also that the data is relevant to the individual counties and states, because it is a national movement. So many states have an ALICE report. The beautiful thing about the ALICE report is it does provide county by county data analysis, looking at how many households are struggling, including the obstacles that ALICE households face on the road to financial independence. And really, it aims to inform and incorporate community leaders, nonprofits, policymakers with the tools they need to really support ALICE families and help them thrive.
Okay, so I think what most folks listening are going to want to know is, what did this report reveal about households across North Carolina?
So really the highlights from the report, 43% of households in North Carolina live on the verge of financial instability and struggle to make ends meet. And when we think about the budget, we call it the ALICE Household Survival Budget. And when we think about that budget, it really is a bare bones, bare minimum budget. We're not including going out to dinner. We're not including extracurricular activities. We're really looking at the bare bones of what it takes for an individual or a family to make ends meet. So the report details out that there are 4.2 million households in North Carolina, and 1.8 live below the ALICE threshold. The ALICE household survival budget for a North Carolina family of 4 is about $78,500, which is well above the federal poverty level of $27,750. The report also highlights disparities in access to banking services, affordable housing, healthcare, and other essential needs. And then the report also looks at how the ALICE threshold spans across races, ages, and genders. And while all of the various demographics, we see that folks are struggling, there is some disproportionate struggles happening. So for example, 58% of Black and 54% of Hispanic households in North Carolina were below the ALICE threshold in 2022, compared to 38% of white households. And so the report also emphasizes just the mismatch between the cost of living and job pay, which contributes to the number of ALICE households.
Mm-hmm. So you had mentioned earlier that this report is really designed for leaders and other, organizations like the Institute for Emerging Issues, those at the county level who work in partnership with others. So what are some things that groups like ours can be doing with this report?
Organizations and state leaders can use the report to its fullest by leveraging the details with the county by county data and analysis provided. This information can help them identify the specific needs and challenges faced by ALICE households in their communities. By understanding those obstacles, then we can all help develop targeted strategies and policies to support ALICE families and to help them achieve financial independence. The report also serves as a valuable tool for advocacy, enabling stakeholders to raise awareness about the financial hardships faced by ALICE households, and to mobilize resources and support to address these issues. It can also inform the development of programs and initiatives aimed at improving access to essential services such as affordable housing, healthcare, and childcare. And it also kind of brings to light this idea of, we often refer to it as a benefits cliff. And so individuals that are working really hard may make just a little bit above what the threshold would be to qualify for some type of government assistance. And once they start earning above that threshold, they may lose some assistance that's really helping them achieve that financial stability. And so it also just sheds light on what are those thresholds and how do we help individuals kind of achieve financial stability whenever they are working, 2 or more jobs or working more than 40 hours a week. We're really focused on individuals that are trying very, very hard to make ends meet, doing all of the things that we would expect them to be doing, but just facing those everyday struggles and really just one decision or one episode away from some other kind of crisis happening.
Yeah, Brittany, I remember that the benefits cliff was something we addressed at the Emerging Issues Forum. And it seems to me that this ALIS report really pairs nicely with the roadmap to financial resilience recommendations that came out of the Emerging Issues Forum as well. And that can be found at emergingissues.org. So tell us about the next steps with your team in this report, and where can people learn more?
Absolutely. So we will actually be releasing an updated report in May. Just so happens with the timing of when our report was finished, we did a public launch in February, but they update it annually in May. So every year we'll be releasing an updated report. And then our team plans to host information and awareness sessions for various stakeholders. We'll do an ALIS orientation and training webinars with local United Way staff and board, covering topics of marketing and communication, fund development, and community impact. We'll continue to meet with our ALIS steering committee and research advisory council just to ensure the quality of the data, the methodology continues to meet standards as new versions roll out. And really just using the ALIS report as a tool to inform and educate the public about financial hardship. It will be used to engage community and business leaders, elected officials, and other stakeholders interested in improving the financial health for North Carolinians who are struggling to make ends meet. And people can learn about the ALIS report by visiting United Way of North Carolina's website, which is unitedwaync.org/ALIS if you want to go directly to the report. And the website provides detailed information about the ALIS report. It includes county by county data and analysis, it includes the key findings and resources for advocacy and support. And then additionally, folks can also go to the United for ALIS website, which is unitedforalis.org. And there's various tools that are available on that website where you can look at reports from across the United States to see how North Carolina compares to other states. But if you click into the North Carolina report, there's also just a comprehensive toolkit where you can easily narrow it down by county, look at the various demographics of the report and how those play out across the various populations.
Well, that's great. And Brittany, we are all over the state. Our team, like yours, is traveling all over the state. So if there are tools or resource PowerPoint slides that we could just embed into our presentations, I think that is a great way for us to be able to share the great work that you're doing and share these resources, because I know our partners would certainly be interested. Well, I do have one final question for you that I like to ask all of the guests of the Connected podcast, and that is, what is the next big issue related to household financial independence, financial resilience that you think that leaders across the state are going to be willing to explore together?
I think the next big issue is really exploring the impact of proposed budget cuts and policy changes on households with financial hardships. For example, I know there's some proposals out there to cut food assistance program through SNAP, or reduce rental assistance, or potentially take away healthcare coverage, which could increase poverty and hardships for millions of individuals and families. So really looking at these changes, how these changes might exacerbate the existing disparities and push more households into financial instability. I think really taking a step back and thinking about the bigger policy decisions that are being impacted and how that's going to really impact the ALIS population, and how do we work together and collaborate and pool our resources so we can provide the most efficient and effective services for those that will be impacted.
Yeah. Well, Brittany, I hope that that's right. And it also makes me think, with this new data coming out, what the 2024 data will reveal after Hurricane Helene, and then future weather related events as well. So again, well, thank you so much. We appreciate all that you do for the state and for all of the counties across the state. But to learn more about the ALICE report, visit unitedwaync.org/ALICE. And until next time, let's stay connected.
This has been a presentation from the Institute for Emerging Issues at North Carolina State University. To learn more, please visit us at emergingissues.org.